The triceps skinfold site is going to be halfway between the olecranon process of the elbow and the acromion process of the shoulder, and it's going to be on the midline on the back of the arm. All right, so midline of the back of the right arm, and this is a vertical fold. The chest skinfold site is the only one that is different between males and females, and the difference is pretty small. All right, so what you're going to do is you're going to look for the armpit, and you're going to look for the nipple of the individual. All right, so if you can't see the nipple, for instance, if they're wearing a sports bra for a female, you're going to estimate where that would be, and you can basically assume that it's in the center of the right side of the chest, at the bottom of the chest. All right, so either way, again, you're going to look for the armpit and the nipple. For a male, you're going to go halfway between those two, and you're going to do a diagonal fold right there. The mid-axillary site is going to be at the level of the xiphoid process of the sternum, so the bottom of the breastbone. You find that and you go around to the side of the individual on the right-hand side, and then you look for the center of the armpit and you go directly below that. So where the lines from the bottom of the breastbone and the center of the armpit intersect, that's where the skinfold site is going to be. Typically on a female, this is going to be right underneath where the sports bra strap is. So you just flip up the edge of the strap just a little bit so you can access the proper site to do the skinfold. And this is going to be a vertical skinfold site. So in order to do the subscapular skinfold site, you're going to go to the back of the individual and you're going to look at the right side of their back. All right, and so you're looking for the point of the scapula where you find the medial border near the spine and the inferior border of the scapula, and you're going to look for that point where they intersect right here. All right, so if you're having a difficulty feeling that border, what you can do is have the person take the right arm, put it back behind their back like this, and that's going to force the scapula to go out towards you, and so you should be able to feel it much more readily. All right, so make sure though that you have the person relax their arm back down, and when they relax their arm, you're going to see the scapula kind of come down, and so you need to just trace with your fingers as that scapula is moving back downward to its resting position. All right, so once you find the appropriate site on the scapula, you're just going to go about 1 inch or about 2 centimeters down and out away from it in a diagonal fashion, and that's where the skinfold site is going to be, and this is going to be a diagonal skinfold. The suprailiac skinfold site is going to be on the right hip of the individual. So what you need to do is you need to palpate and try to find the iliac crest. All right, so once you can trace where the iliac crest is, and sometimes this is difficult and you have to sort of estimate where it should be, but once you can palpate and trace that, you're going to then look for where the front of the armpit is and go directly down from that. So it's going to be sort of on almost on the side of the individual. A lot of people you're going to see do this far too close to the front of the individual. So it's kind of right where the front of the person and the side of the person meet is where the skinfold location is going to be. But again, it's about an inch or so off of the iliac crest in line with the front of the armpit, and this is going to be a diagonal fold. The abdominal skinfold site is going to be about 1 inch or about 2 centimeters to the right of the belly button, and this is going to be a vertical fold. The thigh skinfold is oftentimes the most difficult. The fat, the muscle, and the skin just sort of intertwine sometimes there, but just do your best to separate them as much as you can and do the pinch. All right, so the thigh skinfold site though is going to be halfway between the inguinal crease on the right leg and the patella on the right leg. All right, so the inguinal crease is that crease that your leg makes when you lift your knee up. So it's the crease between your torso and your upper thigh, essentially. All right, so again, halfway between those two on the midline of the front of the right leg, and you're going to be doing a vertical skinfold here.